We'll go ahead and call the statewide substance use response working group to order. Attorney General Ford could not be here today, so I am leading the meeting in his absence. Starting with item number 1 on our agenda, we need to call to, we've called to order. Now we need to do roll call to establish quorums. Do you want to do the official roll call, Kelly?
I would. Kelly Marshall for the record. Chelsea Cheatham.
Present.
Dr. Dixon.
Here.
Senator Doñate. Dorothy Edwards.
Here.
Attorney General Ford. Assemblywoman Hardy. Dr. Shayla Holmes.
Present.
Jeffrey Iverson. Jessica Johnson.
Present.
Nancy Lindler.
Present.
Debbie Nadler.
Present.
Angela Nichols.
Present.
Christine Payson.
Present.
Eric Schoen.
I'm here.
Steve Shell.
Here.
Dr. Slamowitz.
Present.
Senator Stone. Assemblywoman Thomas.
Here.
Vice Chair Shell, we have a quorum.
Okay, great, Kelly. Thank you. Moving on to item number 2 on our agenda. This is public comment for discussion only. I will make a brief statement and then turn it over to Kelly with some housekeeping details. Public comment will be received in person at either of the locations listed above on the agenda. Public comment shall be limited to 3 minutes per person. This is a period devoted to comments by the general public, if any, and discussion of those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241020. So I will now turn it back to Kelly.
Thank you. Kelly Marshall for the record. So just a note, we'll begin with comments from Las Vegas and then invite comments from Carson City. And then we will go virtual. And before commenting, please state your full name for the record. So if you're dialing in from a telephone, please dial 719-359-4580. And when prompted, the webinar ID is 841161568996. And the meeting passcode is 676835. You can press *6 and then either Vice Chair Shell or I will prompt you to unmute. If you're joining with computer audio, you can use the raise hand feature, or you can take yourself off of mute.
Hi, this is Senator Stone. I'm here, by the way.
Thank you, Senator Stone. I will record that for the record.
Thank you.
All right, so I believe Vice Chair Shell, we are starting with any public comment in Las Vegas.
No public comment in Las Vegas.
All right, and then we're moving to Carson City.
There are no public members in Carson City.
And anyone choosing to do public comment virtually, please raise your hand or unmute. Vice Chair Shell, I do not see any requests to make public comment.
Okay, thank you so much, Kelly. So that concludes public comment. We will move on to item number 3, which is a review and approval of our minutes from our full SURG meeting that occurred on October 9th, 2024. Hopefully all of our working group members have had a chance to review the minutes, and if so, we can entertain a motion.
Chair Shell, for the record, Eric Schoen to make that motion.
Great, thank you, Eric. Do we have a second?
Debbie Nadler for the record, a second.
Thank you, Debbie. Do we have any discussion regarding the minutes from our October 9th meeting? Hearing none, all those in favor of approving the minutes, please say aye.
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 Any opposed? Great, motion carries unanimously. Thank you. Moving on to item number 4. This is regarding SURG member appointments and subcommittee assignments. This is informational only. So I will now turn it over to Dr. Terry Kearns.
Thank you, Vice Chair Shell. I appreciate that. I just wanted to start out and highlight to everyone that thanks to our legislators in AB 374, they have the appointments such that about half will expire in 1 year and then the other half in the other year. So we don't have a full turnover in the committee membership in any 1 year. But in looking at it, just so everyone's aware, starting January 1st of 2025, those that you see in this on this slide are the ones that will need to be reappointed. We did get appointment letters, I would highlight, for 2 years through 2027 for Senator Doñate and Senator Stone already. We are still waiting until everything and all of the chairs and the speakers get assigned to get our assignments for Assembly, one member of the Assembly appointed by the Speaker of the Assembly and one member of the Assembly appointed by the Assembly Minority Leader. So all of these others will need to be finalized, and we will do that in our January meeting. So just to highlight that, these are the members that are up for either for reappointment or where we're going to have to get new appointments on those. Moving on to the next slide. This is, just so you know, our current subcommittee membership. And on those subcommittees, you can see some are up for reappointment again, but I would just highlight any members on the subcommittees should reach out to your subcommittee chair or to SEI to indicate if they want to remain on their subcommittee they have been serving on, or if they would like to switch. Or if you haven't already done that, please do that. And anyone who has not joined a subcommittee and would like to, please let SEI staff know. The legislative appointments are still being finalized. During session, the legislators can join subcommittees if time permits. But the last time their membership was paused until after the session so that we wouldn't have issues with them counting against our quorum for those subcommittees. And this, as I mentioned, reduces the issues with quorum and doesn't count against our legislative members' attendance. Any questions or discussion on the appointments, reappointments, and the subcommittee membership?
Yeah, I have a question.
Yes.
Dr. Dixon, I'm not sure I understand this table. Are all these of us that are on this term ending date been reappointed, or?
That will happen in January,
It will
at the
happen.
January meeting. Yep. Yes, that will happen. And I would highlight too that we will also at that January meeting be looking for appointment of our vice chair to the overall SURG, and then also the chairs and the vice chairs to each of the subcommittees. Hearing no other questions, we'll move on. Thank you.
Great. Thank you, Dr. Kearns. Next item is number 5, an update on the opioid litigation, settlement funds, and distribution. So I will turn it over to Mark Kruger. Hello, Mark.
Hi, everyone. My name is Mark Kruger. For the record, I'm a Chief Deputy Attorney General in the Bureau of Consumer Protection. We've been handling the opioid litigation and investigation. I am pleased to let you know, as an updated total, we've recovered $1,147,992,000 and some change there. So that's been a fantastic recovery. Of that, the Fund for Resilient Nevada, which is the state share, will have actually recovered $519 million as a total. From that, there'll be some attorney's fees, but it ends up netting to about $422 million. That, of course, is going to be coming in over a staggered period of time through 2043, so quite a long time from now, but regular increments, the money will be coming in. So that's the good news. Along with that is you can check out the portal. I updated the last meeting. The portal can be found on the Fund for Resilient Nevada's website and shows all the recoveries, where they came from, what defendants they were associated with, etc. That's good through the end of the fiscal year of last year. There's been a few others that have come in. The only major newsworthy highlight to the settlements that I have is with respect to Purdue Pharma and the bankruptcy. As I updated you last time, the United States Supreme Court reversed the bankruptcy court's ultimate rule and the proposed order that it was going to issue. And so that paused everything. The negotiated mediation has begun and has been ongoing. There's been several continuances. There is a chance that it will be continued again, but right now it's due to either mediate out and get a settlement in place, or it will either be continued or things will implode on December 23rd. Understand that the mediation is moving along, so we're hopeful. We remain hopeful that will result in a settlement. So that's all the information I have for the opioid litigation update. If you have any questions, I'd be happy to take them now. Chair, I think you're on mute.
I apologize, everyone. I see Debbie Nadler with her hand raised. I'll turn it over to Debbie.
Right.
Thank you so much. Thank you for that presentation. Just out of curiosity, and I know it was listed before, what is the projected funds from Purdue for us? Was there a settle? What was it?
Mark Kruger, for the record, that's a great question, and one which I'm reluctant to even put a guess on it. At one time, we were hoping to get around 50 million for the state, but I really can't say right now what it's going to look like. And if the mediation is successful, I'm hoping that number will remain or even increase. If the mediation is not, there's a lot of questions as to what we would be recovering.
Appreciate it. Thank you.
No worries.
Do we have any other questions for Mark? Okay, Mark, thank you so much for that great update.
You got it. Take care.
Moving on to item number 6 on our agenda. This is for possible action. We are now going to have presentations of our subcommittee recommendations and rankings for review and approval. And just wanted to go over a few items before I turn it over to Jessica Johnson. So our subcommittee chairs will be providing an overview of recommendations from each of their subcommittees today. Those of you that have received the agenda for today may have made note of the draft annual report that was attached. So hopefully everyone has had a chance to review that has the full recommendations from each of the subcommittees listed. Our subcommittees met in November or December of this year to finalize their recommendations and rank them in order of priority within their respective subcommittees, and those will be included in their presentations today. Following the presentations from each subcommittee, any SURG member can request discussion and/or changes to any recommendation. Any proposed change must be voted on by the full SURG with separate motions for each recommendation. And then for each subcommittee, once all recommendations are approved, any SURG member can request changes to the ranking order, and any proposed change must be voted on by the full SURG. So before we move forward with the first presentation, do any of our working group members have any questions or comments about these items? Okay, hearing none, I will now turn it over to the chair of our prevention subcommittee, who is Jessica Johnson. Hello, Jessica.
Hi, everyone. We can't see ourselves on camera here, so I'm hopeful either you can see me or part of me. Thank you for the opportunity, Vice Chair Shell, to share about the prevention recommendations. My plan today, since prevention subcommittee has the prevention set and the harm reduction set, I'll present the prevention ones and then move into the harm reduction ones, if that is all right with everyone. So, the prevention subcommittee met in December. Our recommendations are included on this slide in ranked order. By way of summary, our first one is to recommend to the departments listed on here to include in their governor's budget request a request to double the amount of investment in the SAPTA primary prevention programming. And for ages 0 to 24, and review the funding allocations annually, not to be at the expense of existing programming. Number 2 is to create a bill draft request to amend the NRS for a 15% set aside for tobacco control and prevention funds from the Fund for Healthy Nevada. This would be distributed using a local lead agencies model to reach the $2 per capita recommended funding goal from the Nevada Tobacco Control and Smoke-Free Coalition and subject matter experts. Number 3 is to require the State Office of Medicaid to develop a state plan amendment to implement changes to support the recommendation requesting rates and billing standards for CHW's community health workers and peers to be increased to align with the national average and CMS standard. And 4 is to create a bill draft request to allocate a 15% set aside of cannabis retail funds to be distributed using a local lead agencies model to reach the $2 per capita recommended funding goal from the Nevada Tobacco Control and Smoke-Free Coalition and subject matter experts. Those are the 4 prevention recommendations, Vice Chair. I don't know if you'd like to take discussion or questions from the committee on the prevention ones, and then I can move into harm reduction.
Yes, Jessica, does anyone have any questions for Jessica regarding these recommendations? Any questions or comments?
Chair Cheryl, it's Terry Kearns. I had just a question. On
Yes,
the last recommendation to create a bill draft request, do you have someone in mind that would do the bill draft request? And if not, is it still too late to get those in this year?
Great question. No, the committee didn't have, wasn't suggested anyone in mind from the SMEs or have anyone that was recommended by our appointees. I don't know the answer to the second part of your question, sorry.
Perhaps one of our legislators would know if we still have the opportunity to get bill draft requests in, or has that deadline been reached?
Hi, this is Senator Stone. If I can answer, we had a deadline yesterday that for senators, at least, that got us to like 18 bills. So we all get more bills when we go into session. I think the senators get 2. I think the assembly members get 1. So there is still an opportunity to get BDRs after we get into session in February.
Thank you.
any other questions or comments for Jessica regarding the prevention recommendations?
Yeah, this is Dr. Dixon.
Yes, Dr. Dixon.
Number 4, I don't exactly understand where this 15% money of the set aside, I see where the money is coming from, where's it going?
Yeah, thank you. Jessica Johnson for the record. So the question is, where would the dollars be going? The recommendation from the subject matter experts would be that it be allocated using a local lead agencies model, which is how tobacco dollars are currently allocated, usually through the Nevada Tobacco Control and Smoke-Free Coalition. So through the local lead agencies who are distributed geographically throughout the state, is my understanding.
Any other questions or comments? Okay, Jessica, if you'd like to proceed with the harm reduction recommendations now.
Sure thing. Thank you very much. Jessica Johnson for the record. Our harm reduction recommendations are such. So the first one was to recommend to DHHS to develop an annual or biannual saturation and distribution plan for overdose reversal medication. It's in this recommendation that DHHS should utilize, I'm combining 3 words in my head. DHHS should utilize opioid settlement dollars to designate a baseline level of identification and overdose reversal medication for the next 10 years in Nevada, which should be based on the state's naloxone saturation plan to create a supply of stable, sustainable overdose medication throughout the state. So in the details of this recommendation, folks will see that there are dollars set aside for overdose reversal medications presently, but they are grant funded. So that's, I think, the nuance in this particular recommendation. Number 2 is to establish a statewide initiative for community drug checking that incorporates qualitative and quantitative drug checking and includes the following parameters seen on your screen. So I'll give folks a moment to read through those. We'll go to the next slide, which is a harm reduction shipping supply recommendation. This recommendation provides for the shipping costs for evidence-based harm reduction supplies and travel costs for the pickups of used sharp products to be returned for destruction. I think this might be repeated twice on here. So I think it's just the first section of this. Is that correct? No.
Number 3, the second half of it.
Mm-hmm.
Mhm.
Sorry, Vice Chair. Just having staff weigh in on the language for number 3.
Oh, no worries, Jessica. Thank you.
Kelly Marshall for the record. So the person who staffed the harm reduction subcommittee, Emma Rodriguez, right, has moved on to the Southern Nevada Health District. It appears to me that it's slightly different language between the first paragraph and the second paragraph saying the same thing. So one starts with, okay, so.
Kelly, the piece about travel costs is different.
Thank you.
And I would note, this is Kim Hopkinson, also with SEI for the record. I'm now staffing the prevention subcommittee, and what is on the screen is what was presented for review at the last and ranking at the last subcommittee meeting. So what is on the screen does match what the prevention subcommittee ranked as written.
Yeah, they definitely are two different things using very similar language. So I think Laura's
Wonderful.
point. Sorry, go ahead.
No, finish your thought. I apologize.
I think the travel cost piece is one.
Kelly, I see now they're just at, as you said previously, they're just kind of reworking some of the same ideas, so we can fix that. So it's streamlined, maybe working with Ms. Johnson to make sure that we get it captured accurately.
Yeah, and I'm happy to hear thoughts from SURG committee members, and perhaps we can take a vote on an amended language today if folks are prepared for that. So harm reduction recommendation number 3 is encompasses shipping throughout the state across inclusive of rural Nevada communities for harm reduction, supply delivery, and pickup for those who can't receive supplies directly. And I'll finish presenting 4, and then perhaps I have a couple more comments. So harm reduction recommendation number 4 is a bill draft request to support legislation that will help fund and establish a statewide association for peers and better define supervision requirements for peers under the age of 18. So those are the 4 harm reduction recommendations that did appear. From the last meeting, there was a harm reduction recommendation that the committee considered and opted not to include based on public comment the prevention committee received. I'm just going to summarize what that is here in case there's the full, just for the full committee's awareness. So a harm reduction recommendation that was considered but not included was to create a bill draft request at the legislature to change the Nevada paraphernalia definition as it related to smoking supplies utilizing Maine or Colorado as examples. SEI staff and myself as the prevention chair received guidance from the prevention subcommittee to reach out to several subject matter experts. Completed that and received some feedback from SMEs on how to restructure that particular recommendation. However, the committee opted not to move forward at this time with those recommendations. Based on public comment that we received, that commenter encouraged consideration by the full SURG of somehow either including or suggesting that that was a consideration yet not included for ranking in their comment into the full report, as they felt that it was a very important consideration from a harm reduction perspective. So including that for your situational awareness alongside perhaps workshopping number 3. With that, finish my presentation, and Vice Chair Shell, happy to take any questions or comments.
Thank you, Jessica. Do we have any questions or comments from any of our SURG members?
Terry Kearns, my comment is the same for 4. Do you have anybody who's willing to take forward that bill draft request at this point, or do we need to seek that support?
Great question. Jessica Johnson for the record. I don't believe, and if my vice chair is on, Mr. Schoen can weigh in, that we have anyone at this time for harm reduction recommendation number 4's bill draft request. Mr. Schoen, do you have any input? Go ahead.
Yes, well, a little bit. So I also serve on the Northern Regional Behavioral Health Policy Board, and their BDR has to do with lifting up peers. I don't think they're addressing the association part of this, but I do believe they are looking to introduce some language to help support peers under the age of 18. So for those who are interested in this bill or in these in peers, I would recommend that you look at what has been drafted out of that policy board.
Okay, I like these subjects.
Any other questions or comments?
Yeah, me, Dr. Dixon.
Yes, Dr. Dixon.
Do you need legislation to establish an association? Is that traditionally done?
This is Jessica Johnson for the record. I don't know
I mean, what kind
the
of
answer
association are we talking about? I mean,
to that. I don't know if others can weigh in.
Dr. Dixon, this is Eric Schoen for the record. I agree with you. I don't believe that an association necessarily, I don't think you need a BDR to start an association. I think that the thrust of this bill recommendation is that we support whatever it takes to help bring peers into being fully integrated for mental health care, because we need them. And so anybody who's interested in building a bill around that will be able to point to this as, I think, that we are in agreement with those kinds of approaches and strategies.
I see Dorothy Edwards has her hand raised. I'll turn it over to Dorothy.
Hi, for the record, Dorothy Edwards. Just for your purposes, it's AB 60 is the Northern Regional Behavioral Health Policy Board bill. Thanks, Eric.
Thank you.
Any other questions or comments for Jessica at this point? Okay, thank you, Jessica. So now we need to go back to our prevention recommendations and ask our SURG members if they have any other questions or comments or any recommended changes to the items that you presented, Jessica. So I'll turn it over to our SURG members in case anyone has any comments or recommendations regarding the prevention recommendations. Okay, hearing none, then we can entertain a motion to approve these recommendations as stated here.
I'll make the motion, Senator Stone.
Thank you, Senator Stone. Do we have a second?
Debbie Nadler, second.
Thank you, Debbie. Do we have any other discussion regarding these recommendations? All those in favor of approving, please say aye.
Aye.
Any opposed? Great, motion carries unanimously. Thank you. Now moving on to the harm reduction recommendations. Again, I will ask our SURG members if anyone has any questions or any recommended changes to these recommendations.
This is
Okay.
Jessica Johnson for
Yes,
the
Jessica.
record. Sorry. I am hoping that perhaps we can workshop the recommendation language in the third one. It does appear that some of the, for example, fentanyl test strips was brought in to just be test strips, and a sentence from later in the paragraph was moved ahead. I'm wondering if perhaps we meant to amend the language and it's and just forgot to edit out the first however many sentences that is, moving down to in collaboration. So I'd like to hear discussion on if to amend out starting at harm reduction shipping supply down to delivery of the supplies directly, the first paragraph, but yet including starting at in collaboration through supplies directly of the second paragraph.
Kelly
Any
Marshall,
comments from
for
our-
the record.
Yes, Kelly.
Vice Chair Shell, I just wonder if you would like me to exit the presentation mode and actually make the change so people can see it.
Yes, please. That would be great, Kelly.
Okay, then Jessica, would you walk me through it one more time?
Sure. So from the number 3, from the first part of it through, I was going to try to count the lines through the words, receive the delivery of supplies directly. You could go down 2 more lines. Correct. And then the first sentence, harm reduction shipping supply, can also be taken out so that it just starts with in collaboration with local lead agencies. So
Sorry,
the first
so
4 words,
Take
number 3.
this out?
No, ma'am.
Okay,
The first 4 words next to number 3, where it says harm reduction shipping
I
supply,
see.
is my recommendation for consideration.
So then what I'm putting in bold is the recommendation.
That is correct as my proposal for the committee's review.
Do we have any discussion from our SURG members regarding this change to recommendation number 3?
Chair Shell, Terry Kearns for the record.
Yes, Dr.
Just
Kearns.
a question. You have on here about returning used sharps and products for destruction. Is there already a mechanism that these returned items will be destroyed? Or do we need to include anything about that piece and funding for that?
Yes, thank you. Jessica Johnson for the record. So it does say in here to provide for the shipping costs and then the travel cost for the pickup of the used sharps. And your point is funding for the destruction. The subject matter experts who have in the past done this indicated in their presentation to us that they had funding support for the destruction. It was the travel costs and the shipping costs that were the burden. Now, if this were another entity or a different group that took this on, that might need to be included.
Any other questions or comments from our SURG members regarding this particular item? Okay, so at this point, we can entertain a motion to approve these harm reduction recommendations as noted here with the changes outlined in item number 3. If anyone is inclined to make that motion.
Christine Payson, I'll move.
Great. Thank you, Christine. Do we have a second?
Dorothy Edwards, second.
Thank you, Dorothy. Do we have any other discussion regarding the harm reduction recommendations? All those in favor, please say aye.
Aye.
Any opposed? Great. Motion carries unanimously. So thank you, Jessica, and to all the members of the Prevention Subcommittee. Thank you. And thank you as well,
Thank
Eric. So now moving on to the treatment and recovery recommendations. Steve Shell, for the record, I will now go through these recommendations listed in priority, order of priority here.
Chair Shell, I'm just taking a moment before I share to get back into presentation mode.
Okay, thank you, Kelly. Okay, great. Thank you, Kelly. So starting with the first recommendation from the Treatment and Recovery Subcommittee, I'll read it as follows. Legislation should be considered to amend the Nevada revised statutes pertaining to the Nevada Bureau of Healthcare Quality and Compliance's employment guidelines for hospitals, including behavioral health hospitals, to hire certified peer recovery support specialists who have felony backgrounds and are within 3 years of their last felony conviction. It is recommended that individuals who were convicted of drug offenses or other offenses that do not involve violent acts or sexual exploitation be considered for employment as certified peer recovery support specialists in hospitals. This is a recommendation that I had made to our subcommittee based on experience throughout the state where hospitals are not being able to hire experienced peer recovery support specialists because of the existing statute, which states no felony within the last 7 years. So as you'll see in our recommendation here, we're asking to have that changed to 3 years of their last felony conviction if legislation is considered. Item number 2, our recommendation number 2. This was a recommendation from Dorothy Edwards through a presentation made by Michael Berry. This is to support BDR 95 to ensure Narcan be available on all campuses under our Nevada system for higher education, including in student unions, health centers, all levels of the dormitories, residential advisors' domiciles, sports facilities, and libraries, and to include training of the administration of Narcan, which can take place during online freshman orientations, much like we already disseminate information about Title IX during orientation week. Training can be offered throughout the year by various clubs and programs within each institution's design. And just to note here, BDR 95 is co-sponsored by Assemblywoman Brown May and Senator Titus. Third recommendation is to support access and linkage for treatment of trauma for people with substance use disorder or those who have overdosed, and for surviving family members after an overdose fatality, and to support training for healthcare professionals to identify and address trauma. And this was a recommendation made by Chelsea Cheatham. And then our last recommendation, number 4, is to direct the Division of Public and Behavioral Health to identify a funding mechanism for hospitals and providers to enhance the bridge program for emergency departments by incorporating peer recovery support specialists into their treatment models, and to support the use of peer support navigators via telehealth to increase access to treatment and support for individuals identified in emergency departments. And this recommendation came to our subcommittee through Dr. Kelly Morgan, who is a physician here in Nevada. So that concludes our recommendations from the Treatment and Recovery Subcommittee. I see Debbie Nadler with her hand raised, so I'll turn it over to Debbie.
Thank you so much. These are great recommendations. I have 2 questions to ask. On number 1, sorry, I'm trying to make it bigger so I can see it. I love that you're reducing it to 3 years. Perhaps, is there some kind of wording that we could put in there where they're drug tested? Does that make sense? to make sure they're still like in recovery and not using? And the reason I'm asking is my son had a counselor in one of his rehabs that he was in who was 3 years into recovery. And when he fell, the dominoes collapsed. I mean, is there, I don't know if I'm wording this properly. Is there some kind of something in there where they have to be drug tested just at random?
You're raising a great point, Debbie. I would really like Dr. Kearns or someone else on the Attorney General's team to weigh in on this. I'm not sure what's reflected in the current statute regarding drug testing. I'm just curious if it may currently be in statute. Does anyone know? Oh, I see Assemblywoman Claire Thomas with her hand raised.
No, I was waiting for, thank you, Chair.
Oh.
Assemblywoman Claire Thomas, for the record. Just because I have an opinion that whoever hires this person would automatically have them generally drug tested. So, you know, to subject a person to, you know, you're bringing attention, undue attention to that person, I think that's taking it a bit far.
Yeah, another great point, Assemblywoman Thomas, and I will stress too that I know from my own experience, yes, hospitals and other employers around the state do have their own drug testing requirements. So that's a very good point, Assemblywoman. Debbie, I'm not sure if that answered your question, but I'm
No,
open to.
but that's okay. I wondered, you know, if there was something in place. I saw things happening. Unfortunately, y'all know I lost my son. I'm friends with hundreds of thousands of moms who've lost their children, and we've seen the cracks. We've seen what's happened. So it was just a recommendation, but I understand the other part of it too. But my second one, under number 2, love this one. Here's my question, because I've asked for this for a few years now. As far as the Narcan availability in our school systems, somehow the wording got put to shall instead of must. And I've been asking this for a couple of years now, where it says the schools shall have Narcan and not must. And I was told, because I've called a lot of schools and they don't carry it. And because of that one word in the bill that was passed has the word shall instead of must. So is that something that can be included in this number 2 somehow?
Debbie, if not to put Dorothy Edwards on the spot, but I'm just curious, Dorothy, if what may be currently outlined in BDR 95, it's my understanding that it will require the Narcan to be available if the BDR passes.
It does. I would need to go back and see whether it says must or shall. At the risk of sounding really naive, because I do this a lot, but is shall less strong than must? I mean, I always obsess over may or shall or may or must when I'm writing, and so I've never really thought much about must or shall. So I would defer to our learned legislator, Assemblywoman Thomas, or someone else for a opinion on that. But Debbie, in respect to you, good question. I don't know what that the narrative of the BDR shows. I don't have that in front of me.
I appreciate that. In talking with CCSD, they specifically, and you could be right, I could be wrong. It could say may, not must. It's something that's not as strong as must. I do know that. And it's been a couple years, And now that I'm thinking, maybe it says may, but I know it was two different words. I know it was that one word.
Well, may is certainly more permissible, gives us the option, where must is, we must do it. And shall, well, that I kind of view shall as a nicer way to say must, but again, I don't know.
Thank
So
you. I appreciate if somebody could look into that, or I've called all the school boards.
Vice Chair Shell,
Yes,
I believe
Kelly.
Jessica Johnson has something to add in, and we do have our Deputy Attorney General Estunio, who could potentially tell us if shall and may are the same thing, and if it's like, or shall and must are the same thing, and if it's likely that the difference is between may and shall.
Thank you, Kelly. I'll turn it over to Jessica Johnson and then our Deputy Attorney General.
Thank you. Hopefully you can hear me from this section of the room. Just
Yes.
confirming. Jessica Johnson for the record. So a couple of components. My understanding is that the legislation that Ms. Nadler is referring to, part of the reason for the language was that for the school system, it was included within the legislation around nurses having EpiPens on site. It's the same section of the legislation requiring that. My also recollection, which it's been a couple of years, so open to being wrong, is that including the word shall instead of may, which I believe was more permissible, also happened to be wrong about that, was that requiring it would also have added a fiscal note that then would have been prohibitive for the legislation to move through at that time. So those are my initial thoughts to those components, having been privy to the process when that bill was moving through. I did have a couple of recommendations to this, but I wanted the subcommittee to present them all, unless you're taking recommendations now for discussion.
Jessica, let's get the Deputy Attorney General to weigh in on our question, then we can come back to you if that's okay.
Thank you.
Okay, thank you. So at this point, I'll turn it over to our Deputy Attorney General Estunio.
Joseph Ostunio for the record. So if I understand correctly, the question is, what is the difference between may and shall, right?
Yes.
So shall is a requirement. May is optional. Those are very stark differences. So may means like basically, if they decide to do it, then they can. And then shall is they're required no matter what.
And must?
Must, I believe must and shall would be the same.
That was kind of our question. And
Oh, I thought somebody said may. I apologize.
well, understanding may is a more permissible, but we were talking about must and shall. To me, I wasn't sure. Shall sounded like a more polite way of saying must, but wasn't sure if there was an actual difference.
They're both basically the same. They're both like an obligation. So yeah.
Thank you for that clarification.
That's my opinion.
So before I go back to Jessica Johnson, I see that Debbie Nadler has her hand raised. Debbie?
Yep, sorry. So I'm probably wrong, and it probably said may, because I'm positive they told me they didn't have to do it based on what was written.
Okay.
So it probably did say may. I know it was an option. That's what they told me. So if we could just get something done for our school systems, I love everything we're doing, but I don't see anything on anything that's directed at our school systems directly for our kids. And this, I would love to see happen, that it is an absolute requirement.
Thank you, Debbie. And I will add that our subcommittee was not aware that Assemblywoman Brown May and Senator Titus were going to pursue a BDR. So it really coincided with what we had already been discussing as a subcommittee.
I think it's great. Thank you.
Thank you, Debbie. Before we go to Jessica Johnson, I see our Deputy Attorney General also has his hand raised.
Yeah, I want to say, if you want to make it very clear that something must be done, I would insist on using must instead of shall, because must, there's no ambiguity. Shall, there's a little bit of ambiguity. So must is a much stronger language. I just wanted to say that on the record.
Okay, thank you. So Jessica, thank you for being patient. I'll go back to you now, Jessica Johnson.
Yeah, thank you so much. Jessica Johnson for the record. Just a couple of components here. I didn't know if the committee was certain of the language and that this aligned with BDR 95 at this time. So I wanted to raise that. And then I was curious about the use of the word Narcan here, and if naloxone or opioid overdose reversal medication had been considered, if the committee could share more how they arrived at Narcan specifically for this recommendation. Thank you.
Yeah, great question, Jessica. And I'll turn it back to our subcommittee members if they can help me remember why it is we focused on Narcan. Dorothy, any comments there?
The presenter and then the subsequent presenter who presented it the second time and provided some clarification did not say, but Narcan was the verbiage used throughout the discussion, and there wasn't a request to change that. I like the change, but there wasn't, I don't think, as I recall in our discussion, unless our fellow committee members remember, any specific discussion on why Narcan and not something broader.
Yeah, I don't remember either, Dorothy, unless any of our other fellow subcommittee members remember.
Vice Chair Shell, Kelly Marshall.
Yes, Kelly.
For the record, since I staffed that treatment and recovery subcommittee, I would just note that I believe the intent was actually more aligned with Ms. Johnson's suggestion that it not be a particular brand, but that it be overdose reversal medication, because there are other medications beyond Narcan or brands beyond Narcan that that achieve the same objective. So that is something that could be amended in a motion.
Hello, this is Senator Stone. Maybe an appropriate description would be narcotic antagonists, which will encompass a lot of, naloxones, naltrexones, and things like that. If that helps.
That's helpful, Senator Stone. Thank you.
Narcan is going to infer a particular brand of naloxone, right? There are many generic companies that make naloxone or naltrexone. So narcotic antagonist would be a good generic term for describing that type of medication that we want to have on the campuses.
Yeah. And this is Dorothy Edwards for the record. Senator, would their administration, using that term, the administration of that would be the same? As we understand, the administration of Narcan or naloxone, but there aren't any other that would fall into that would require some specialized method of administration or anything.
Not when you're dealing with one generic name versus another. Yes. I think
Thank you.
Correct. Yeah.
So Kelly, before we entertain a motion to change or approve these recommendations, do we want to go ahead and make that change to item number 2 and then have that considered?
Vice Chair.
Yes, Dr.
This is Terry Kearns. I'm so sorry to interrupt you. I just had a comment. I think there was previous legislation, and I don't remember the number, but then also with the grant funding, there was a very big effort to make sure that it always said opioid antagonist, to Senator Stone's point, so that there's different brands, there's different administration methods, those sorts of things, as opposed to naming one specific brand. So I know in other state documents, and I believe other legislation, it said opioid antagonist.
Thank you, Dr. Kearns.
That'd be great.
I see that Kelly is making some changes to our recommendation number 2. While she's doing that, I see Eric Schoen has his hand raised.
Yeah,
I'll turn over
thank
to Eric.
you. Thank you, Vice Chair Shell. A quick question. I may have missed it. Are these rank ordered by the subcommittee?
They are, Eric, yes.
Okay, thank you.
Yes, thank you.
Vice Chair Shell, Terry Kearns for the record. I just had the same question on number 1 that I had for the prior to Jessica. Is there anyone that's been approached about carrying the BDR to revise the NRS?
Not that I'm aware of at this point, Dr. Kearns. No. Kelly, are we also including the word must before be available?
Kelly Marshall for the record. I did not hear clear direction to do that, so I'm waiting to hear clear direction if that is the will of you, Vice Chair, or the subcommittee.
My fellow subcommittee members, do you feel like we should include the word must to then be considered as part of a motion if such is made?
Debbie Nadler for the record, I do.
Thank you, Debbie.
Chelsea Cheatham for the record, I also agree.
Okay, thank you, Chelsea.
Nancy Miller for the record, I agree as well.
Thank you. Thank you, Nancy.
And Assemblywoman Claire Thomas for the record, I agree.
Thank you, Assemblywoman Thomas. Okay, so everyone should see the changes that Kelly noted in recommendation number 2. Do we have any other discussion regarding these recommendations before we entertain a motion to approve these recommendations as noted?
Claire
Chair
Thomas.
Shell, this is Terry Kearns.
Yes, Dr.
I'm
Kearns.
sorry, I'll defer to Assemblywoman Thomas first.
Okay, thank you. Assemblywoman Thomas.
Kelly made the correction that I was looking at. Thank you, Kelly.
So Dr. Kearns, and then on to Debbie Nadler.
Yes, my only comment was I just wanted to highlight that this BDR 95 is focused on our Nevada system of higher education and not the high schools and middle schools and those sorts of things. So just for clarification.
Yeah, thank you for that, Dr. Kearns, because that's come up in our previous discussion. So thank you. And Debbie Nadler.
Thank you. Is there a way we can add middle school and high school to this? The must.
Talked about that as a subcommittee, Debbie, and I'll let my subcommittee members weigh in on that.
This is Dr. Dixon, I'll weigh in. Whereas I appreciate the desire to have this in the schools, the public schools, I think you're dealing with such a different administration that it would need to be a separate bill altogether. You can't really, and then you're talking, and then there's, I don't know how many school boards around the state. So I think it needs to be totally separate. Not that we're proposing to put a bill like that. We're just, I don't think we can combine them into one bill. No.
Assemblywoman Thomas.
We should kill it.
Assemblywoman Thomas for the record. I ditto the doctor's remarks because I believe in our discussion, we did bring up that about the local schools, because then you would have to create something that would include the charter schools and so on and so forth. I think that this BDR 95 for higher ed right now is something that we target.
Thank you, Assemblywoman. Debbie Nadler, I see you still have your hand raised.
Yes, thank you. I appreciate that. I understand that. I guess my next question would be, who do I contact? Because it wouldn't be a new bill, right? It would be a modification of a word in a bill. So does anybody know who I can contact?
Well,
To try
Debbie,
to get that
Assemblywoman
word.
Brown May and Senator Titus are the co-sponsors of this bill. So that would probably be the best start, is to reach out to them.
Okay, thank you.
Yeah.
Hey, Deb, Terry Kearns for the record. I would say too, if you're looking to have language modified on prior legislation, you could reach out to LCB and find out who sponsored that legislation and talk to them too about having it revised in the prior legislation for the schools.
Perfect. Thank you. Thank you.
So at this point, we can entertain a motion to approve these recommendations from the Treatment and Recovery Subcommittee as noted here. If anyone is inclined to make that motion.
Debbie Nadler, I make a motion that we approve.
Senator,
Thank you, Debbie. Do we have a second?
Senator Stone, second.
Thank you, Senator Stone. Do we have any further discussion regarding these recommendations? All those in favor, please say aye.
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 Any opposed? Motion carries unanimously. Thank you all. Moving on to our response subcommittee, I will now turn it over to Dr. Terry Kearns.
Thank you, Vice Chair Shell. The response subcommittee met and took the guidance we received from the larger SURG on our recommendations and then rank ordered them. And the first response recommendation is to recommend research into the implementation of a statewide data sharing agreement with the Chief Data Officer of the state and implementation of a cross-sector database housing multiple points of data across prevention, treatment, recovery, and criminal justice to include data such as controlled substance outlets, tobacco, cannabis, alcohol, to help tailor interventions geographically. And I would highlight that we did add that language about the data on controlled substance outlets such as tobacco, cannabis, and alcohol from a recommendation from, I believe it was a prevention subcommittee. In our second ranked response recommendation is to support the collaborative proposal to the Fund for Resilient Nevada to conduct wastewater sampling of high schools, college, university campuses, and bars and nightclubs, and use information gained to develop public health awareness programs, deploy targeted naloxone, increase provision of fentanyl test strips to targeted locations, and to develop a plan for expanding high-risk substance wastewater surveillance in our state and review the outcomes from this pilot project to identify if it and similar targeted programs may aid in the community response. And I would highlight on this recommendation, we've been told that the Fund for Resilient Nevada did fund the wastewater project out of UNLV and the Southern Nevada Health District. So there is already funding, but we just want to support those continued efforts. The third recommendation from the response subcommittee is to resolve the conflict between the Good Samaritan Drug Overdose Act and drug-induced homicide law. Immediate actions may include recommending community-level education using best practice guidelines, as well as education for law enforcement personnel and exploring options for altering the Good Samaritan language to expand coverage to a greater population of individuals living with substance use disorder. Couple of things to highlight in this recommendation is there is already some education that's been done for law enforcement and will continue to be done out of CASAT. And then there's also some public messaging campaigns being done, either under the Fund for Resilient Nevada or from DHHS. So those components are being undertaken, but we continue to support those efforts. But the main gist of this is really to expand coverage to a greater population of individuals living with substance use disorder. And that's because, as we've heard in testimony to legislation and also to our response subcommittee members, is that there are still people who are afraid to call 911 out of fear of being arrested. So that's why we seek this. I would also add on this that Senator Stone, I believe, would take this on as a BDR, and we have provided a white paper and also our recommendation with the research and everything to him. Recommendation number 4 from the response subcommittee is to review the operations and lessons learned from the Clark County Regional Opioid Task Force when that body's report is released in December of 2024, and take this into account when supporting legislation to establish regional overdose fatality review committees, allowing flexibility as to the makeup and practice, and for those OFRs to remain at the county or regional level as needed, to effectively identify system gaps and innovative community-specific overdose prevention and intervention strategies in accordance with established best practices such as BJA's Overdose Fatality Review, a practitioner's guide to implementation, and that funding be provided through the Fund for Resilient Nevada. And to support this recommendation, additional funding may need to be provided to the coroner or medical examiner's office for personnel. I would highlight on this that I did reach out to the Clark County Opioid Task Force, and they are right now in the process of getting their report finalized, and will get us a copy of that as soon as it is. But I have read the draft, and there's a lot of great recommendations in the draft report that I have seen. Moving on to our next recommendation, recommendation number 5. From the response subcommittee is recommend state agencies under the legislative, judicial, and executive branches involved with deflection and diversion programs have a comprehensive definition of recidivism and policies related to measuring and reporting recidivism. Our last recommendation is recommendation number 6, implement a voluntary program to install drug take-back bins in retail pharmacies. And that's the 6 rank ordered recommendations from the response subcommittee. If anyone has any questions or discussion.
I see Debbie Nadler with her hand raised. I'll turn it over to Debbie.
I'm sorry. I think, can you go back to number 1 or 2, the first page, if you don't mind? The Good Samaritan.
That was 3.
Number 3, yeah, the Good Samaritan. I remember we had a meeting last year where Attorney General Aaron Ford said something that we were going to be doing something with Good Samaritan. If I'm not mistaken, we were actually going to vote on doing something. And I cannot remember the language, the wording. We were talking about doing billboards and promotions on that Good Samaritan. I just can't remember it. I know that 90% of kids use with other kids and 90% are found alone. This is like so imperative, this Good Samaritan. And actually, I would be willing to work with Senator Stone on this if I could, if I'm able to. This is one of my strongest passions, this Good Samaritan.
Deb, if I can respond, I think the meeting that you're thinking of was a combined meeting between the ACRN and the SURG. And there was discussion in that meeting that billboards and other things were going to be done. I don't know if it was out of the Fund for Resilient Nevada or through DHHS or both.
You're right. It was with all of us, and it was last year, and I think it was last November, if I'm not mistaken. Thank you.
Yeah, Yeah, I think that was that meeting. And as I said, we have provided what language we've had in the research to Senator Stone, but I'm sure he would welcome feedback.
Yeah, great recommendations, Terry. Thank you. These are great.
And this is Senator Stone. I would be happy to sit with you. And unfortunately, I got a lot of this information a little bit late, and I wasn't able to do the kind of due diligence I need to do before I get a BDR submitted. So it was not submitted. A BDR was not submitted for this in the last batch deadline. Like I said, we do get a couple other bills in February where we can certainly consider it again. And so I'd be happy to sit with you and chat with you about that if you'd like.
Thank you. I work with a lot of other states, and there's a lot of bills that have been passed, which might help us.
Yes. Thank you.
Thank you.
Okay, do any of our, yes.
We have
go
a
ahead.
question, Jessica.
Hi, thank you. Sorry, Jessica Johnson for the record. Thank you, Response Subcommittee, for your recommendations. I have a question about number 6. I was wondering in this voluntary program, who would be responsible for emptying the drug take-back bins? And is any program like this already in existence? Perhaps that's in the background of the report. Thank you.
So this is Senator Stone. There's already a voluntary program out there right now, and the pharmacies are paying the cost for the bins and paying for the cost of the disposal. So that's been organized by the pharmacies at this point in time. We're hoping that we can use some of the opiate money to offset some of those costs so we can have more of these bins and other pharmacies. And we have a very large, brand new incineration center, if you will, in Reno that should be built and operational right now that might make things even less expensive to pick up and incinerate. So I think this is good. I have a BDR, by the way, for the drug take back bin program, and I'm hoping to get into more specifics within the BDR as to how that will all come together.
Thank you.
One thing I would add to Jessica is it might be a case too of perhaps getting the coalitions involved because I know they do work with the police departments, and we do have 5 incinerators regionally throughout the state that were funded by the Attorney General's office in 2017, 2018, that perhaps could work with the coalitions and get some of these drugs to those to be incinerated. And I believe that Nye County is trying to get a second one for the Lincoln County area as well.
Great. Do any of our other SURG members have any questions, any recommended changes to the response subcommittee recommendations?
Senator Stone will move approval.
Thank you, Senator Stone. Do we have a second?
Assemblywoman Thomas, second.
Thank you, Assemblywoman Thomas. Is there any further discussion regarding these recommendations? All those in favor, please say aye.
Aye.
Any opposed? Motion carries unanimously. Thank you to the response subcommittee. So that now concludes all of the recommendations from our 3 subcommittees. So we will move on to item number, I see Eric with his hand raised, Eric Schoen.
Yeah, thank you, Vice Chair Shell. I just wanted to comment how impressed I am by both the depth and the breadth. And I think the increased sophistication of the recommendations that we've made this year. I'm really impressed with the work of all the different subcommittees. These are a really, I think, potent set of ideas that can be borrowed and used and leveraged for this next legislative session and into the future.
Thank you for sharing that, Eric.
Thank you.
So item number 7 is for information and discussion. This is a review of the updates to the annual report template. So I will turn it over to Laura Hale. Hello, Laura.
Hello, thank you, Vice Chair Shell. Kelly is going to go through some of the screens. The template you saw back in our October meeting of the SURG. And so we basically just updated based on the work of the subcommittees that took place in November and the one meeting in December. So we're gonna just go down to page 3, which is where the recommendations start. And so basically you'll see.
Hey, Laura. Laura,
yes.
it's Terry. I'm so sorry to interrupt you, but those of us here in Vegas, we're hoping we could get a 5-minute bathroom break before you get into this, if that's okay.
Amen.
Okay, yeah. So on that note, we will take a 5-minute recess and see everyone back here in 5 minutes. Thank you all.
Mr. Chair, could you state a time to return? I know you said 5 minutes, but can you state the exact?
Oh, I'm sorry, Deputy Attorney General. We will return at 3:21. Thank you.
Perfect. Thank you.
Item number 7 on the agenda, I will turn it back to Laura Hale.
Thank you, Vice Chair Shell. So this, as I said earlier, the template we reviewed in November. So what we have today is just the updates based on what our subcommittee chairs presented. And so if you go, you'll see on the page that Kelly has up on the screen there, starting on page 3, that's where the recommendations come in. And so for the prevention recommendations, those stayed as is. Under harm reduction, we had that change under item 3 with the language so that we basically took out the first paragraph, so we won't have those redundancies, and that will be updated ahead of the January meeting. And then for treatment and recovery, we will replace that language on Narcan with opioid antagonists that must be available on the campuses for N-sheet. And then moving down to response subcommittee, there weren't any changes there. And so all of those will be formatted into the final that we'll present back to you in January. And then moving on to page 7, there's all the detailed recommendations. So pages 7 through 25, for each recommendation, we have all of the detail that our subcommittees worked very hard on with our members submitting and then discussing action steps, impact, capacity, justification, background, the urgency of each recommendation, and then any equity issues that might be addressed. So that is a good portion of what will be in this annual report. And then if you go to page 25, or 26, sorry, that's where you'll see the different appendices, which basically have some of the additional information that was provided by the subcommittee. So Appendix A, those pages are 27 through 36. And basically it's additional information and includes research links. And then for Appendix B, those are in pages 37 through 47. And that's basically a crosstab. And Kelly, if you want to skip down to 37, people can kind of see what that looks like. All those links are really important. It's just you kind of know what those are. These tables basically show what the requirements are within the legislation. And so you can see different target groups that are impacted by a particular recommendation. So that's just a handy cross table that was created for people to be able to see that. So that's target population impacted. And then Appendix C starts on page 48. And that one shows the different, yeah, if you go, sorry, Appendix C is additional information on the recommendations and the legislation addressed. So those are, go all the way through page 57. So if you keep going down, you'll see a table. That information there is just taken out of the legislation. So yeah, this is the table that tells you specific requirements of the legislation, how those are impacted by each recommendation. Thanks, Kelly. And then if you go to Appendix D, starts on page 58. This is, so these are the updates that were provided to us by different divisions within the Department of Health and Human Services. So it will show your 2023 recommendations that came from the SURG, and then updates that we received, you'll recall, back in October from these different divisions. And what we thought was that it made sense to include in this annual report every year, you'll see what are the updates for the previous year's recommendation. If you want to go back to years prior to the immediately preceding year, all of that information is online on the AG's website. There's a SURG information page that has all of that. So from there, we'll go down to page 70, which is Appendix E. And that has information regarding SURG membership and structure. So that's the SURG info page. So you can see membership, bylaws, prior updates on prior reports. And then, so it's a separate website than where you go to get the meeting materials. Those are available because of the posting requirements. They're in order by date. So there are two different sites on the AG's website where you can look for, depending if you're wanting, meeting information, there's the meeting materials site. If you want information on membership, bylaws, and prior reports, that's on the SURG info page. So then if you go down to page 71, that's for Appendix F, information regarding opioid settlement funds. As you all know, there's an excellent dashboard now that's under the Fund for Resilient Nevada, where you can go and get up-to-date information on the settlement funds. And then Appendix G is basically for the Attorney General's signature. So we would bring this back in January, making the updates that we referenced and finalizing that. We would encourage folks to take a look at some of those appendices so that if you have any questions or concerns within your specific subcommittee or a specific recommendation that you put forward, to make sure that that's accurately reflected. We do review these internally, but as noted, we did have a staff change recently, and so we had some redundant language. So if you have an opportunity between now and January to take a look and let us know if you see anything, we'd be happy to make those changes. But you will have that opportunity at our January 13th meeting to take one last final look before we get the AG's signature and send that off to the governor and the legislature and other recipients. And if there are any questions or comments about the report, we'd be happy to try to answer them.
Any questions or comments for Laura?
Dear Shell, Terry Kearns for the record.
Yes,
I
Dr.
just would
Kearns.
like to thank SCI for the extensive amount of work they put in to put this great report together.
I'll second that, Dr. Kurtz. Thank you. We do appreciate all their hard work on this. Any other questions or comments for Laura? Okay, thank you very much, Laura. Moving on to item number 8 on our agenda. This is a review and consideration of items for our next meeting for discussion only. So I will turn it over to Dr. Kearns.
Thank you, Vice Chair Shell. First of all, I would like to just highlight that our meeting in January, we typically meet on Wednesday, but our meeting in January is January 13th, which is a Monday at 1 o'clock instead of 2 o'clock. So I just wanted to highlight that for everyone. I think you probably have already gotten calendar invites on it, but I just wanted to highlight that for you. And for our January meeting, we're going to finalize appointments. It's primarily for those legislative spots, and reappoint or appoint members to the subcommittees. And we'll also be appointing the vice chair for the SURG and the chairs and vice chairs for the subcommittee. We will also have members will be asked to approve the final annual report and review the tentative schedule for our upcoming meetings. So that's what we have on tap for those. If you could go to the next, just to let you know what our schedule typically is the full SURG meets on the second Wednesday of the month from 2 to 5, and that's quarterly typically. The prevention subcommittee meets on the first Wednesday of the month from 3 to 4:30. Treatment and recovery meets on the first Tuesday of the month from 12 to 1:30, and the response subcommittee meets on the first Tuesday of the month from 11 to 12:30. So I would highlight that the treatment and recovery subcommittee meeting time and the response subcommittee meeting time do slightly overlap by a half an hour on those first Tuesdays of the month. So that may be something we want to look at if there's any problem. If there's members of the public that like to attend both of those meetings, or any staff or anybody who wants to attend those meetings as well. And then I think that is all. If there's any discussion or comments from the committee members.
Okay, any questions or comments from our SURG members? Okay, thank you very much, Dr. Kearns. Moving on to item number 9 for discussion only. This is public comment. Public comment shall be limited to 3 minutes per person. Members of the public may comment on any matter that is not specifically included on the agenda at this time. However, no action may be taken upon a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to subparagraph 2 of NRS 241010. So I'll turn it over to Kelly with some other housekeeping details. I think Kelly may have stepped away, so I'll just share
Sorry,
that. If you,
I think Kelly may be muted.
Apologize. Kelly
there we
Marshall
go.
for the record. I was talking, but I was muted. So if you're dialing in from a telephone, please dial 719-359-4580. When prompted, the webinar ID is 8411-6156-896. And the meeting passcode is 676835. You can press *6, and that will indicate that there is public comment, and we can ask you to unmute, and the vice chair will recognize you.
Thank you, Kelly.
So Vice Chair Shell, I don't know if you want to start with Las Vegas and then go to Carson, but we do have, we also have a hand raised from the public.
Okay, Kelly, let's start with Las Vegas. Do we have anyone in Las Vegas?
We have no public comment in Las Vegas.
Anyone in Carson City?
No public comment in Carson City.
Thank you. And then I know, Kelly, you said someone had their hand raised.
Yes, so JMP Corona would like to make public comment.
We'll turn it over to Mr. or Ms. Corona.
Hello, this is Dr. Partita Corona. I'm a member of ASAM, well, Nevada ASAM, I should say. And one of the obstacles that we're running into, and I don't know if this is the proper forum for it, we're running into a problem of getting addiction specialists to be able to work in the hospital setting here. I'm not sure how familiar any of you are with what's called delineation of privileges, but that basically allows for specialization of different fields. For example, let's say you get admitted to the hospital, you have your hospitalist, which is basically your primary physician, and should you need, say, hemodialysis, they consult nephrology, and nephrology is able to be paid for their services because they are recognized as a specialty. That does not exist for addiction medicine, which is why you have no addiction services in hospitals for the most part. The only time that you see those hospital services are those that are being supported by grants or by universities, which is basically through grants. So this low-lying fruit is basically requiring delineation of privileges in the hospital setting from all our hospitals, so that they allow for Medicare and Medicaid and other insurances to pay for that specialization of services in the hospital setting. Does that make sense? So
It does, Dr. Corona. We appreciate you bringing up this topic. Can you share which part of Nevada you were in?
I'm in Las Vegas.
Okay.
But I know it's a problem statewide. In fact, it's a problem nationwide. But it is a simple lift, really, is requiring hospitals to set up delineation of privileges for addiction specialties in order to, say, have access to these funds, which I think is kind of a pretty basic ask, is that you just allow an avenue for physicians to practice their specialty in their hospital setting.
Dr. Croner, you bring up a great topic that one of our subcommittees may certainly, be interested in inviting you to one of their future meetings in the coming year to present more on that topic, so that our full SURG membership can then, get more information. But we do appreciate you bringing this up.
Okay, thank you.
Thank you. Anyone else wishing to make public comment, Kelly? I don't see anyone.
I don't see any other hands raised.
Okay, thank you. That concludes our public comment. Item number 10 on our agenda is adjournment. So we will now adjourn our full SURG meeting. We'll wish everyone a great holiday season and look forward to seeing everyone at our next meeting in January. So thank you all for being here today.
Take care, everybody.
Thank you, Chair. Happy holidays to everyone.
Happy holidays. Thank y'all.
Happy legislative session.